All right. Hello, everyone. Michele Crosmer here with Dr. Sean Hashmi, and we are back with plant-based kidney health. And we have probably the absolute biggest question we are always asked today is, how can someone lower their creatinine levels?
All right, this is an excellent question, and there's a lot of stuff on the internet that's not necessarily correct. So please, as you hear this stuff, don't go for the hype. Let's start off with the biggest way you can lower your creatinine. So if you have extra weight and you bring that weight down, you're going to produce less creatinine, and it's going to show up as a lower creatinine in your blood. But it's not just an artificial thing where your creatinine is lower from healthy weight. What it will do is there will be less pressure on the kidney. That means less filtration. That means less scarring on the inside of the kidney. So a healthy weight is probably the single biggest thing you can do to protect your kidneys going on. Now, if you're somebody who's younger, who's into bodybuilding and lifting and all that stuff, you may have heard of supplements called creatine. It's very, very safe, but creatine converts inside your muscles to creatinine. So if you take it, of course, it's going to look like your kidneys are worse. The second you stop it, it will flush out of your kidneys and your kidney function will be back to normal. So creatine supplements can make your creatinine, which is how we tell how your kidneys are doing, look worse than it actually is. Then in addition to that, there are still medications that are used very, very commonly, frankly, because they work. But these medications will make your creatinine look worse artificially. You want to know this because if you're trying to lower it, don't do your blood test while you're taking these medicines. The most common of which is an antibiotic called trimethoprim, still used a lot going on. There are these antacid type of medicines called H2 blockers, common one being cimetidine or ranitidine. If you're on any of these and you take your blood test, it will make it seem like your creatinine is worse. Simply by stopping, you will notice that your kidney function looks better. Now, another one that's actually very, very simple but not really understood that well is the more meat you eat, specifically the more you cook the meat, what happens is the creatine inside things like red meat, the more you cook it, will actually convert to creatinine inside the meat. So if you're somebody who's a big time meat eater, you will find that your creatinine inside your blood will be higher. Not to mention the creatine that comes from meat will convert to creatinine inside your body. So two ways that you will end up seeing that your creatinine levels are higher. But keep in mind, we did another episode where Michele talked about the renal acid load and how certain foods, specifically things like meat, add that acid. So even though we're talking about the fact that meat may look like your kidneys are worse, and if you stop it, it'll make the creatinine look lower, there are long-term consequences to eating foods that are rich in meats going on that also affect kidney function. Now, one thing that we always talk about in plant-based kidney health is fruits and vegetables, nuts, seeds, legumes, etc. It's the fiber content. And so what the data shows, now these are correlation studies, they're not causation studies. So what that means is it's an association, but we're not saying that A for sure causes B. When we talk about fiber, because fiber has so many other benefits and the foods that are rich in fiber, they have all these other things in it, it's hard to know for sure that it's just the fiber. But what we know is higher fiber intake is linked to lower creatinine and overall better kidney function. So there was a European Journal of Clinical Nutrition study back in 2015, and what they showed was that in addition to lowering creatinine in people who are having the highest fiber intake, as expected, they also had lower toxin levels, or what we call urea levels going on. Then in addition to doing all those things, if you take a lot of NSAIDs. What are those things? Motrin, Aleve, Excedrin, all those brand names, right? Essentially, it's ibuprofen or some version of that, naproxen, etc. Those will actually decrease the blood flow to the kidneys. And as a result, it can make it look like that the creatinine is worse. Now, if you take NSAIDs at high doses for too long, you will get kidney damage from it. If you're taking it short term, you may see an elevation in creatinine, and when you stop it, the blood flow is restored. You will see that that number is better. Another thing is salt. And the reason we talk about salt is when we cut back on salt, what it ends up doing is it reduces the intraglomerular or the pressure inside the kidneys. High pressure inside the kidneys will lead to scarring of the kidneys, fibrosing of the kidneys, and kidney damage, which translates into higher creatinine. So cutting down salt may not directly lower your creatinine, but it will certainly help to reduce your risk of kidney disease getting worse, which does mean your creatinine will stay the same. And in some cases, because of all of the extra stuff that happens, you may actually see that the creatinine comes down. Alcohol is another factor. You know, United States, I've talked about this many times before, but United States has some of the loosest guidelines in the world when it comes to what's recommended for alcohol intake. And one of the best designed studies that was done over 30 years showed that there was a linear relationship, meant the more you drank, the more your brain shrank. So one more time, the more you drink, the more your brain shrinks. It does not matter if it's one drink or two drinks. It's all linear. So the more you drink, if it's 3 drinks, it's worse than if it's 2 drinks. And so knowing that, it doesn't mean you can't enjoy a glass of wine here and there. But what it does mean is that if you're having alcohol every day, this is a great opportunity to cut back on it. And what we know is that alcohol will directly damage the kidneys, not indirectly to the liver as we previously thought. It's direct. And as a result of it, cutting back on alcohol is very important. So I'll tell you what my philosophy, what I tell my patients is 1 or 2 drinks a week. I know that sounds terrible. I'm a bad person for saying it, but at the same time, it will help you in the long run in so many facts. So remember, you can still enjoy alcohol, just cut back on it. And then my favorite is coffee. What the data shows, and there are a number of studies that have come out that show that 2 to 3 cups a day, caffeinated or decaffeinated, is linked with lower risk of kidney disease. It's linked with overall lower creatinine going on. So that's a number of items you guys can try. Try 1, try 2, doesn't matter where you start, but give those a shot and you will have fantastic results. Thanks so much for your question, guys. And as always, we'll see you next time.